Hi, it's Dr. Rich here from Salvatore Dental. We get a lot of questions about dental implants, so in this video, I want to go over some of the most common questions that clear up any confusion. So a common question I get are, what are dental implants? So there's a few things that dental implants can do. Basically, a dental implant is a replacement for a tooth. One way to look at a dental implant is when you're missing a single tooth and we want to replace that tooth with something that stays in permanently and is the most like a real tooth, a dental implant is the best option. So what I tell my patients when we're replacing a single tooth with a dental implant is basically the implant is a titanium root. So you think about a tooth has a root, kind of like a root on a tree. And instead of having a tooth root, we have a root that's made out of the same surgical grade titanium that they use for knee, ankle, hip, shoulder replacements, etc. Except for it's much smaller. So we put a little implant in where the tooth should be and think about it as a titanium foundation or root. And then after adequate healing time, we put something on top of it that's called an abutment, which is more of a titanium substructure, and then on top of that, a crown. So eventually we have got a tooth that instead of having a natural root, it's got the root of an implant. We brush and floss it normally, and the tooth does not come out. So that's how we place single teeth, or we can place multiple teeth that way. Other ways we can use implants is that patients who need like a full reconstruction. So say they have teeth that need to come out or they're in dentures, then we can place fewer dental implants to have all of the teeth. So this way we're using fewer number of implants as a foundation. So if you think about a table has 4 legs. So if we can get 4 solid implants all the way across, say to replace all the top teeth, for example, 4 solid implants, then we can have a bridge that goes all the way across from molar to molar, and that bridge stays in. It's actually screwed onto the implants and doesn't come in and out. It's a great solution because we have minimum amount of implants and maximum amount of teeth, and we can do that on top and the bottom. So it's another way we use implants. Additional way we can use implants are patients who have teeth, the dentures that just don't really work well and they tend to come out. We see this a lot with bottom dentures. Patients are speaking and the teeth on the bottom, because the tongue is moving, start to come forward. So we can place 2 or 4 implants. That foundation of an implant now can have a little guy that comes over the top, like a male end, and then the existing denture has a little acceptor, female end, and now the teeth can snap down and they can snap out. So for our denture patients who are kind of suffering with teeth that are moving around and they just want to gain some stability and they're okay with teeth coming in and out, we can use dental implants to now have the teeth snap down and snap out and be much more stable, assisting with chewing and speaking and smiling. Question that we get a lot is, what conditions can cause me to not be a candidate for dental implants? There's not too many conditions. Thankfully, dental implants are very readily acceptable by most people. If you think about our population, as we get older, a lot of patients have knee, ankle, hip, shoulder replacements, and that's made out of the same titanium as dental implants. So some indications that an implant might not be the right fit could be if you don't have enough bone, because we have to make sure that there's enough bone for that implant to go into, as not nice as that sounds, but if there's not enough foundation for the implant, then it's just not going to work. Another thing could be uncontrolled diabetes. We got to make sure that our patients with issues with diabetes, that's under control, because that makes it so the implants don't really want to heal correctly. And then there's other medications that we'll go over to make sure that you're not on them, or if you are, then we get the appropriate approval from your MD or physician. Other contraindications is we don't love patients who are smoking, so we try to stay away from smoke. Smoking in general is not great for healing, and especially when you're putting in a nice, new teeth or a bunch of new teeth, we want to make sure that it's a smoke-free environment. What are the benefits or risks of dental implants? Very valid question. Benefits for me are outrageously better than the contraindications or the risks. The benefits are, speaking, smiling, chewing, being confident. A lot of our patients, as a dentist, I think they're coming in just because they can't speak and they want to be able to smile and chew. And I don't realize that there's this whole emotional component. A lot of people are held back from the quality of their teeth and they don't want to go out and they don't want to see friends, or it's holding them back socially. So one benefit that I see a lot is kind of being more comfortable with yourself and going out and having fun with friends and family because you're finally confident about your smile. So some risks with dental implants, not too many, honestly. We do everything here to set up to minimize risks. We want to make sure that there's adequate bone quality, that our patients are healthy enough, they're not on certain medications, or they're at least stable, making sure it's kind of like a smoke-free environment. So as long as the bone quality is there and we have adequate ability to heal, dental implants generally do work really well. Like anything in life, there are situations where things sometimes don't work. Dental implants tend to be in about the 98% success rate. So if we're doing 100 implants, that means 2 of those implants most likely could have an issue. In rare cases where there are issues with dental implants, the dental implant fails and has to come out, we can always graft or add bone in that area, let everything heal, and then we can put a new implant in. So as much fun as that isn't, we can at least repair implants that have issues. And patients want to know, how does a dentist decide if dental implants are the right solution for me? Just like anything, there's a bunch of different types of dental providers out there, or medical providers out there, or people have all different types of skill sets. Here at Salvatore Dental, we do a lot of different types of dentistry. We do a lot of implant dentistry, a lot of regular general dentistry, veneers, crowns, bridges, pretty much a whole bunch of different procedures. So the way that I look at each patient is, what is the best procedure to get you in the end result that you would like and that you want and that you need? If I only did implants and there's nothing else done in this office, then an implant generally would be the solution that you'd be offered. So the benefit of being here is that some of my patients get implants, some of my patients get bridges, some of my patients, we end up doing a denture because that's the correct decision for all of us. So it's kind of matters where you go. And I always tell my patients that you want to go somewhere where you're getting multiple, almost like second opinions, but under the same roof. And here we do that because my dad has an implant, my mom had a bridge. So we do both. It's just kind of dependent on each patient's situation. Patients ask, what are the steps to getting a dental implant? It's different everywhere, but here it's pretty straightforward. We do a lot of guided surgery and guided planning. So the first step for a dental implant is you come in, we have a consultation, we take a 3D scan, we make sure that the bone quality is good, that we're healthy enough for the procedure, that we go all over the risks and benefits, and then we end up with a treatment plan that's great for our patients. And if that is a dental implant treatment plan, then we would do an additional scan. So we do a 3D scan that kind of shows like the x-ray in the bone. And then we actually do a scan in the mouth, kind of like, instead of having the old school Gookie impressions, we take one with a scanner. I take the scan in your mouth, which is your teeth and your gums and everything like this. And then, believe it or not, we merge that scan with the x-ray scan. And then we virtually do your surgery. So we're going to take the implant on the computer, we're going to place it exactly where we want it to be in your jaw, and then using some of our technology that we've been using since 2017 here, we've had 3D printing since 2017, which seems like a long time ago. We 3D print out a guide. So when you come in for your dental implant, I've got a 3D printed guide. It literally goes over the other teeth or somewhere in the mouth. There's no teeth, we stabilize it. And then the implant and the whole procedure is done guided through this 3D printed material. What's great about that is we're not going in blind. We know exactly where we want to be. The control is there. We're using computers, we're using guided technology to make sure that implant is safe, stable, and in the correct position. That also means that actual implant procedure is very quick. So I tell my patients, if we're doing a single implant, once you're numb, you're in the chair maybe 10 or 15 minutes. So it's that fast. And it's not just good to be fast, but it's good to be efficient. The faster we're in and out, the easier the healing, the less invasive. So first visit, after everything's planned, you come in, we get you nice and numb, use any type of level of sedation that you're comfortable with and we're comfortable with, get the implant in. Then there's some healing time. So if it's a normal implant, we're gonna be healing for about 3 months. So during that first 3 months, the bone and the implant are connecting together. Then after that 3 months, we've got 2 quick visits to get you your final tooth. How long does a dental implant last? It's a difficult question to answer because it kind of matters on how well you're able to take care of the implant and how often we see our patients. So I kind of equate it to buying a car. So the first day you buy the car, it's nice and shiny, it's got wax, everything is looking good, it's got the new car smell. And then they always say, come back after your 10,000 mile or 20,000 mile checkup, we got to rotate the tires and change the oil, etc. So it's the same thing here. The day you come in and we deliver that crown, it's beautiful, it's got the new crown smell to it. And then we want to make sure that we're seeing you for follow-up visits. Now, the last thing we want to do is have our patient disappear for 10, 15, 20 years, and if not properly maintained, just like teeth, dental implants can fail. So that's why here, Salvatore Dental, you're part of the family. We want to see you every 6 months for a cleaning, x-rays every year, and we're checking the health of that implant. If there's any indication that needs a little bit of extra oomph to fix some kind of small issue, then we'll do that. So if properly taken care of, implants should be indefinite as long as we have that proper care and maintenance. And once you're part of the family, we're here to look at it. So a common question we get is the dental implant procedure painful? On paper, it sounds pretty crazy. I mean, you're taking a titanium screw and putting into my jaw. That sounds horrible. So I get on paper, it sounds pretty bad, but it's actually not as bad as you think. Majority of our patients afterwards just take some over-the-counter ibuprofen. They feel great. The day of, a little bit of pain and maybe some discomfort, and a little bit the next day. And after that, generally they feel better. And I always equate it to having a tooth out. So it should be easier healing than having a tooth removed. Having a tooth removed is much more traumatic because the tooth might come out in pieces. There's a lot more healing that needs to take place. But when an implant goes in, the tooth is already missing. We just kind of peek the tissue open, put the implant in, and we can put the tissue back together. So it's not as invasive as a tooth coming out. What sedation options are available? We really have a whole bunch of different ways we can help our patients with being comfortable in the chair. We have a lot of patients who are very comfortable. The way we do dental implants is very routine. It's almost like a filling or a crown. If you're comfortable with the filling or crown, then honestly, a regular local anesthetic being fully awake is a great option. It's a very fast procedure. You can drive yourself. We get really great results with being fully awake. But if we have some anxiety, which I understand a majority of people do have anxiety in any dental office, then we have a conscious sedation where you are awake, but you're a little bit out of it. So this is one where we can take a pill, it's like a pill sedation, and helps with some anxiety. When you come in the office, you're still awake, but you have some help with not being so anxious. We do need a driver, and we can also couple that with some laughing gas. And that way our patients are super comfortable in the chair. A lot of times they can't really remember the procedure. It's a little kind of like a murky day. So that's a great one kind of in the middle. And then for our bigger procedures, because we do like full mouth dental implants, some of our patients opt to be fully out. So in that case, we bring a board certified anesthesiologist in. She sets up the whole room, it's IV sedation, and you're literally sleeping. So complete control over being asleep and waking up, very safe. And it's a great way for patients who don't even want to walk through the door to get the treatment that they need. Another great thing when you're fully asleep is that we can do a little bit more treatment. So if it's like a bigger treatment plan, then sometimes we can really accomplish the whole plan in one sitting. So one of the biggest questions we get and most common questions is how much do dental implants cost? It's a very difficult thing to answer via phone call, via email, text, that kind of thing, because every situation is so different. We have patients who come in who think they need all their teeth removed, and honestly, their teeth are in pretty good condition. We have patients who just need a single implant. So there's a whole slew of different treatment plans that we can't really answer over the phone. So what we do here is we have a free consultation. You come in, we take free x-ray, 3D, and that way we can come up with an exact time, money plan that we can go over with each patient. And we also have many financing options here, a whole bunch of ways to be able to pay for dental implants over time, because it is an investment. Even a single implant is an investment. We have ways of paying 1 year, 3 years, 5 years, up to 12 years. So the best thing I always tell patients is come in, meet us, make sure you feel comfortable here. We go over your plan free of charge to you guys, and then we can come up with also a financial plan that works. Another question we get pretty often is, do insurance plans help with dental implants? A very difficult one to answer also. There's a lot of fine writing with dental insurances when it comes to implants, when it comes to replacing teeth. There's a thing called the missing tooth clause. So if you didn't have a tooth when you sign up for the insurance and then you want to replace the tooth, they're not going to pay for it. So there's a bunch of fine little writing that they write with asterisks underneath dental implants. So it's difficult to say. And then also dental insurance tends to have a pretty low deductible this day and age, usually $1,500 to $2,500 a year towards all of your dentistry you're going to do in that year. So that also will hopefully help with implants, but it's a difficult thing once again to be able to gauge. So I tell my patients the same thing: come in, meet us, come in for a free consult. We can kind of go through the insurance questions specifically for you and figure out a plan. Another question we get is, how do I schedule an appointment to come meet you guys and figure out dental implants? Very easy thing to do. You can call us, of course. Our number is 518-899-6068. Salvatore Dental right here in Malta, New York. We're also on Facebook, Instagram. You can send us a message that way. You can email us, office@salvatoredental.com. So there's a bunch of different avenues to come and to get to meet us. Best thing to do, like I said, is come to our place, meet the staff, meet the team, and make sure you're feeling comfortable about the treatment here. I hope I've been able to answer some of your questions regarding dental implants. If you have any questions or if you'd like to ideally come in to meet us, we're here to help.